explaining also why we decided to host this event. So I imagine the participants in this event will be all too aware that the population in Gaza has consistently endured dire humanitarian conditions for many years now. This is in very large part due to the stifling access restrictions that Israel has imposed on Gaza as part of its closure or blockade policies. These prevent the movement of people as well as the flow of crucially needed goods, supplies, and resources, which are unable to go in and out of Gaza. Now, over the last few months, these ongoing hardships have been compounded by the effects of the COVID-19 pandemic. Contending with COVID-19, as everybody by now will be aware, is extremely difficult, even under the best of circumstances. But in a place like Gaza, where the circumstances are anything but ideal, and where the resources needed to respond to the pandemic are extremely difficult to come by, the challenge of overcoming COVID-19 is even greater. And there's much cause for concern that the pandemic will have especially devastating effect in Gaza. Now, one of the complicating factors in responding to COVID-19 in Gaza is that this requires coordinated action by different and for the most part antagonistic authorities. Inside Gaza, Hamas has de facto control over key governmental functions. Some key services, such as securing the provision of medication or paying healthcare staff, are controlled by the PA. Israel's control over the external envelope of Gaza and thus over the movement in and out of it gives it extensive influence over the conditions of life in Gaza, including with respect to healthcare. And then finally, third states also have a crucial part to play. So with this diffusion of power and influence, there are multiple practical problems that come about. And in addition to these practical problems, there are also questions of law that arise as a result of this diffusion of power, including notably the question of who is responsible for what. And at the Diakonia IHL Center, we've been working to provide an answer to that legal question. Last month, we published a legal brief outlining our conclusions. The brief focuses mainly on health-related obligations, but it also touches upon obligations related to livelihoods and education. Today, my colleague, Dr. Elvina Potele, who is the author of the brief, will provide an overview of our findings and our recommendations in that report. But before we turn to the law in detail, and in order to get a clearer understanding of what really is at stake here, we are very privileged and grateful to have with us representatives from organizations that have been engaged in efforts to overcome the practical challenges of responding to COVID-19 in Gaza. These are in the order in which they will speak. Beth Oppenheim from the human rights NGO Gisha, Dr. Sajah Ftiha from the Palestinian Medical Relief Society, and we're really grateful to her for stepping in at the last moment to replace a colleague who unfortunately could not attend as was planned, and Dr. Ben Bouquet from the World Health Organization. Now, before passing on to them, and even while Elvina will elaborate on the law, after we hear from the other speakers, I want to provide you with some preliminary background on the applicable legal framework. This should be helpful to kind of keep in mind as you listen to Beth and Sajah and Ben. Very basically, there are two main bodies of international law that are applicable and relevant with respect to protection of people in Gaza during the pandemic. The first is international humanitarian law. This is a body of international law that regulates armed conflicts, including situations of occupation. IHL, international humanitarian law, imposes an extensive set of obligations known as the law of occupation on a party to an armed conflict that occupies foreign territory. Now, Israel has been insisting since the so-called disengagement from Gaza in 2005 that it no longer occupies Gaza. In fact, it denied that it was an occupier even before that, but it's more insistent on that point since 2005. And because, as it claims, it's no longer the occupying power, it's no longer bound by the law of occupation with all those obligations that it imposes. in our view, and this is a view we share with many others, this position is incorrect. The occupation continues when the occupying power retains effective control over the territory. And as you'll hear from the speakers after me, even without permanent military presence, Israel retains extensive control with far-reaching influence over many areas of life in Gaza. As a result, it remains bound by the law of occupation. Now, at the same time, it's true that Israel does not have control over all areas of life in Gaza, and that there are areas in which Hamas has de facto control. In our view, and this again is a view we share with others, the scope of Israel's ongoing obligations is a function of the control that it actually exercises. So for example, if it controls movement in and out, everything that results from its control over the crossings, including, for example, the transfer of medication, is something that's still its responsibility. Under this pragmatic approach, Israel is bound by the law of occupation in relation to those issues or areas of life over which it has control, and only in relation to them. But IHL is not the only body of international law that's relevant here. The second one is international human rights law. International human rights law applies at all times, both in times of armed conflict and in times of peace. And both Israel and Palestine are parties to most of the international human rights law instruments, including the International Covenant on Economic, Social, and Cultural Rights, which contains a number of provisions relevant during the COVID-19 crisis, including the right to health. Obligations to respect, protect, and fulfill human rights of Gazans rest on different actors. And Elvina will elaborate on this, but very generally, the PA is bound by human rights law in its own territory, and this includes Gaza as part of the One Palestine. Hamas, as the de facto local authority in Gaza, also bears human rights responsibilities. And it's widely accepted that Israel too is bound by human rights law vis-a-vis Gazans, to the extent that it has control over their enjoyment of human rights. And it does have extensive influence over their capacity to enjoy human rights, including with respect to healthcare. So with this background in mind, I'll now pass on to our first speaker, Beth Oppenheim. Beth's presentation is titled Disengaged Occupiers, Israel's Enduring Control of Gaza. Thanks, Beth. Over to you.
Hi. Good morning, everyone, and thanks very much, Eitan, for that broad overview of the legal framework. I'm not going to delve too much into the legal aspect of this because I think colleagues will cover that more thoroughly. But what I will talk about today is, as Eitan has already outlined, this kind of myth that really took hold after 2005 and after the disengagement from Gaza by Israel, that Israel no longer bears responsibility for the Gaza Strip. So this was a kind of claim made by the Israeli government following the disengagement that it would no longer have obligations towards the Gaza Strip. And that's something that we see kind of very prevalent among the Israeli public to this day. And there tends to be this view that what's happening in Gaza is an unfortunate humanitarian crisis and the result of the policies of the de facto authority in Gaza, Hamas, rather than anything that Israel bears responsibility for. And so as an Israeli human rights organization focusing on Palestinian freedom of movement and specifically Gaza, we try to push Israel to meet its obligations towards the people of Gaza and across the OPT as a whole, and to counter the very minimalistic approach that Israel takes towards its obligations, towards its responsibilities. So as Eitan has already alluded to, Israel only sees its responsibilities going as far as allowing vital goods in and out of the strip and allowing people to leave Gaza only in humanitarian cases with an emphasis on urgent medical cases, which is obviously an exceedingly narrow interpretation of its responsibilities. And I think what's also important to say is that very often in the kind of discourse around this, particularly the Israeli political discourse, the closure of Gaza is justified under these very broad security-based arguments. And as Gisha, what we've been trying to do is to show and kind of unpick those arguments and show how politically motivated some of this policy is. So we've done a lot of work around the idea of the separation policy, which is something that Israeli officials have explicitly acknowledged So the deliberate attempt to isolate Gaza from the West Bank in order to basically allow Israel to take demographic control of the OPT and to keep Gaza's 2 million residents out of the so-called demographic equation, and basically strengthen control over the West Bank as well through the de facto annexation process that we're seeing there today. So as Eitan has already said, Israel continues to exert a great deal of control over the Gaza Strip. And that manifests across a broad spectrum of life inside Gaza. So I'm going to just talk through how some of that control manifests to this day. So Israel still denies sea and air access to Gaza, and it controls its land border crossings with the exception of the Rafah crossing with Egypt, although Israel still controls registration that takes place there. So as you'll know, Israel also monitors and controls all goods that are entering and exiting Gaza. Israel can also determine how much fuel, for example, can enter the strip, and therefore it can dictate electricity supply, sometimes with devastating consequences. And all of this taken together meets the test under international law for effective control. And as Eitan said, that means that the laws of occupation continue to apply in Gaza as well. And that's why in the title of the presentation, I use this expression that we use at Gisha, that Israel continues to be a disengaged occupier. So there may no longer be a kind of military presence in Gaza in the same way as there is in the West Bank. There may no longer be settlers there, but Israel continues to be an occupying power. And that means that Israel is bound by the laws of occupation, where it continues to exercise control. And that engenders responsibility. And of course, the Palestinian authorities also have obligations in those spheres that they control relative to the degree of that control. And I think Alvina will talk a bit more about that later. So there's significant administrative control that Israel continues to exert over the Gaza Strip and the OPT as a whole. So something that's very significant, and we find it's very, very relevant to the legal work that we do at Gisha, is Israel's continued control over the Palestinian population registry. So this determines who is recognized as a Palestinian resident and therefore who's able to travel. So that's for both Gaza and the West Bank. And any changes to these records actually require Israeli approval. So that's things like registrations of births, marriages, deaths, and also problematically for many people, address changes. So back in 2010, it was estimated that 20,000 Palestinians wanted to have their registered address changed to the West Bank. That number, of course, is much, much higher now. And then significantly, and I think Ben may touch on this later, Israel's continued control over the tax system. So under the Paris Protocol, which was part in 1993, Israel collects VAT and customs on behalf of the Palestinian Authority, and then it's able to decide whether or not to transfer the revenue. It should do that automatically, but of course this becomes subject to kind of political whims, and it means that at times Israel doesn't transfer the revenue, and that can be used as an instrument of political pressure. And these clearance revenues make up between 65 to 75% of the Palestinian budget. And so that leads to basically what is a kind of crisis management, budgeting in Ramallah, financial instability, and that has very wide-reaching consequences for the economy across the OPT and of course in Gaza. So we have these incidences of non-payment of civil servant salaries in Gaza, as well as difficulties with the PA being able to fund public services, including, of course, healthcare. So there have been times where the PA has been unable to purchase, important drugs or medical equipment because of this instability caused by the non-transfer of these clearance revenues. So that's just a little kind of picture of how things look on the administrative side. And of course, the permit regime is very much part and parcel of that. And I'll talk a little bit about that in a moment. So Israel has a very great deal of control over the land inside Gaza as well. So via the crossings, the entry and exit points from the Strip. So as you'll know, as it stands, there are only 2 crossings that Gaza residents can use for pedestrian travel in and out of the Strip. So there's the Rafah crossing with Egypt, and there's the Erez crossing into Israel. And the Erez crossing provides the shortest route to the West Bank for Gaza residents. And of course, in order for a Gaza resident to leave via the Erez crossing, they have to go through Israeli security clearance procedures. And they also have to meet Israel's very narrow criteria, which are not very transparent. That's something we work on at Gisha to try and make this more transparent. And they also change, they fluctuate. So it's very difficult for Gaza residents to understand what's required for them to be able to leave the Strip. So there are mostly individuals would fall into three categories. So those holding trader or merchant permits, medical patients and their companions, and other what's known as exceptional humanitarian cases. So that could be people who are traveling to attend a wedding or a funeral of a first-degree relative, or visiting terminally ill first-degree relatives. So really the kind of extremes of life experience. And you know, looking at the situation inside Gaza in terms of movement and access, before the pandemic, one might have thought it couldn't get much worse, it couldn't get much stricter or tighter. Actually, what we've seen during the pandemic, since the pandemic hit the region in March, is that it's become even tighter, even more suffocating. Movement has virtually ground to a standstill during this period. And Israel has basically used the pandemic in part as an excuse to tighten the closure still further. And I think it's evident that there are political factors at play here. If for example, if you compare the situation with movement in and out of Gaza during the pandemic versus, say, Israel's own willingness to open its own economy, and also to permit some mobility to and from the West Bank in line with its own economic interests. So again, this is something that seems to be somewhat politically motivated, particularly given the stringency of quarantine facilities that were imposed by the Hamas authorities, and also the fact that there was no community transmission inside Gaza until August, yet there was still virtual kind of hermetic closure of the Strip. So we've been pushing Israel throughout this period to try to expand travel for Gaza residents. It's basically only been accepting travel for urgent medical patients and companions, really a handful. And so we've been pushing to try and expand access for other people as well. Just to give you a sense of how little the movement has been, in 2019, on average, there were around 15,000 exits of Palestinians via Erez each month. And over the last 6 months, there have been just under 650 exits on average per month. So a fraction of the movement that we were seeing before the pandemic, which of course, still for a population of 2 million is very low anyway, even before the pandemic. And I think colleagues will speak more to the kind of implications for healthcare access of these restrictions on movement of people. But of course, as you know, this is very difficult for the medical sector. So it's difficult for medical personnel to enter, and it's also difficult for medical staff in Gaza to be able to access training opportunities that they might want abroad or in the West Bank. So Israel bans Gaza residents from studying in the West Bank completely. So that's just a word on movement of people. And then, of course, Israel also exerts a great deal of control over the movement of goods too. So Kerem Shalom crossing with Israel, that's the only commercial crossing between Gaza and Israel. That's Gaza's only commercial crossing. So Israel dictates what comes in and out, quantities, quotas, which goods can be sold in Israel and the West Bank. So there's very kind of restricted access for goods also. And during the pandemic, we haven't seen goods affected so much. So they've basically been operating as normal during the pandemic. But you can imagine that, of course, the ability for medical supplies to enter is controlled by Israel too. So that's extremely relevant when it comes, say, to the issue of the vaccine. And then we also have the issue of dual use goods. So since 2010, Israel has allowed goods to enter Gaza, but it very, very severely limits and in some cases completely bans the entry of dual use goods. So goods that are civilian in nature, but Israel also believes can be used for military purposes. And this is a real problem for the manufacturing industry, for the communications industry, and of course for the medical sector, because it includes very broad categories. So things like communications equipment, items that are needed for construction, like wood planks, things that are needed for agriculture, like fertilizer, as well as, of course, for healthcare. So the security establishment requires a special application for every piece of equipment, medical equipment, to be brought into the Gaza Strip, and coordination for this kind of equipment takes about a month. So that makes things very difficult, of course. There's also the kind of control that Israel exerts in what's known as the access restricted area, or the buffer zone, which stretches 300 meters into Gaza from the border with Israel. So Israeli officials say that farmers can come 100 meters from the fence, provided that they have advanced coordination. But in practice, many farmers basically find it impossible to get this advanced permission, and the army can fire at farmers that they deem to have come too close to the fence. So that makes it very dangerous for Gaza residents who want to basically just farm their land and access livelihoods. So we've also seen incidents back in 2020. There were 49 military incursions by the Israeli IDF inside Gaza. So this is basically what the IDF calls leveling operations, which they deem necessary for security. But that leads to destruction of crops, destruction of agricultural equipment, so irrigation systems and things like that. And we've also seen reports of this so far in 2021 too. So, as I talked about this idea of disengaged occupation, this isn't to say that Israel's military have no presence inside Gaza, even if it's not kind of, in the way that we recognize in the West Bank, as well as also crop duster planes spraying, spraying crops in the access restricted area and killing them as well, which is also justified on the basis, Israel justifies it on the basis of security and the need to have visibility, but again, causing a lot of damage, economic damage and damage to people's livelihoods and also to food security inside Gaza. So before I close, I'll just talk briefly about the sea access as well. So Israel demarcates Gaza's fishing zone, so where fishermen are permitted to fish. So similarly to farmers in the access restricted area, this makes just making a living very dangerous for people. So fishermen who are deemed to have exceeded this demarcation line are arrested, shot at sometimes, their boats are confiscated, their boats are damaged. So again, making things very difficult and punishing people just for making a living, essentially. And the fishing zone is used as a kind of measure of collective punishment. And I think that's important to say throughout all of this. The overall closure is collective punishment, illegal under international law, so punishing Gaza residents for acts that they didn't themselves commit. But also Israel tightens and expands the closure in a very punitive way. So things like crossings closures, so preventing the entry of fuel. We saw that back in August. Israel virtually shut down the Kerem Shalom crossing in response, or framed in the response to the launch of incendiary objects across the border from Gaza into Israel, leading to the shutdown of Gaza's power plant. And similarly, Israel also completely closed down the fishing zone at some point during this period of escalation as well. So this is a measure of collective punishment. And of course, the constant fluctuations make it very difficult for fishermen to know exactly where they're permitted to fish. So back in 2019, Gaza's fishermen were notified of changes to the fishing zone 19 times. So this constant fluctuation makes it very complicated for fishermen to, not inadvertently breach the fishing zone. So we also obviously see that Israel has forbade the building of a seaport and an airport, which the airport was destroyed in an Israeli air raid back in 2001. Only last week, we saw the PA was forced to shut down Palestinian airlines due to insufficient funds. And Gaza's airport only actually functioned for 2 years after it was opened in 1998. So you'll see that there's a real picture here of control across so many aspects of life inside Gaza, and that gives rise to a legal obligation to protect Gaza residents and to facilitate normal life as far as possible. And that means protecting the health of Gaza residents, as well as their right to livelihood, to food security, and so forth. So I think that's something that we've also talked a lot about at Gisha over this period, is the need to balance the health concerns also with the economic implications of the pandemic. So the need to expand access for goods where possible, and also to allow movement of people where possible as well, in order to facilitate economic activity at such a time of economic hardship across the world, but of course specifically in Gaza, where the economic situation was so fragile after decades of closure and recurrent conflicts. So I'll end there. Thanks very much, and happy to take any questions later.
Thanks very much, Beth. Our next speaker, Dr. Gisha, will present on the current situation in the Gaza Strip and the impact of COVID-19 challenges, response, and recommendations. Thanks. Saja, we can't hear you. Perhaps you're on mute.
Hello.
Hi, we can hear you now. Great.
First of all, let me thank you for giving me this chance to speak in this briefing on COVID-19 challenges and legal issues in the Gaza Strip. This briefing gives us an opportunity to shed some light on the suffering of Palestinians in Gaza who have been living under the Israeli siege for more than 14 years. And before starting my presentation, please allow me to say again that the main cause of the humanitarian crisis we are suffering from in the Palestinian territories is the Israeli occupation and its practices, such as imposing an unfair siege on Gaza and controlling all over the crossings and natural resources, and the continued building of illegal settlements and establishing a new apartheid regime in the world. We must always remember that a radical solution to the humanitarian crisis in the Palestinian territories can only be achieved through a political solution. Now we will go to the presentation, the health situation in Gaza Strip. When it comes to the health situation in Gaza, we must not forget the factors that determine our health and well-being, including the economic, social, and political situation, education and employment, income, equality, and democracy. These are very important determinants that have a considerable impact on our health. Okay, now the causes of the current health problems in Gaza. People suffer of many health problems and challenges, and this is mainly due to the long-standing Israeli occupation, the repeated Israeli attacks and violence, and the siege and the isolation imposed on the Strip, which has turned it into a large open-air prison. All those causes have undermined Gaza's health system capacities and pushed it to the brink of collapse. And as a result, the health sector in Gaza is unable to meet the population health needs, which in turn put their health at high risk. Now we will go to the impact of a blockade on the socio-economic situation. In general, the siege damages all aspects of life in Gaza, including health, power supply, water and sanitation, income, job opportunities, education, and so on. So the unemployment rate in Gaza increased from 43% in 2018 to 53% in 2020, and the youth, unfortunately, the youth employment, it is at 64%. The food insecurity rate reached to 68%, and 80% of Palestinian families in Gaza became more dependent on humanitarian aid. Now, the main characteristic and feature of the health system, it is fragile, it is over-fragmented, overstretched, and deteriorated. So the challenges and obstacles of the health system, we have a chronic shortage of drugs, which stands at 45%. And we have a shortage of medical supplies, it is at 33%. We lack spare parts of medical equipment and machines. The Ministry of Health in Gaza is unable to cover the operational expenses, and 35% of Gazan children under 5 years of age are at risk of not meeting their full mental potential. The rates of mental disorders increased, and patients were unable to receive their treatments outside Gaza. Healthcare providers are lacking access to educational programs and trainings. Health demands is on an increasing trend, and we have a frequent power cut, which affects negatively on the continuity and the quality of the provided services. So we will go to the situation of COVID-19. It is a comparison between Palestine and Israel in terms of expenditure on health. West Bank spent per capita, West Bank and Gaza spent per capita $293, while Israel spent 2,820, and this is in 2018. We will go to the number of ventilators, and in 2020, West Bank has 8 ventilators per 100,000, while Gaza has 5 ventilators per 100,000, while Israel has 40 ventilators per 100,000. The number of tests, it is per 1 million. West Bank has 235,000 per 1 million, while Gaza Strip, it is 120,000 tests per 1 million, while Israel 997,000 per 1 million. And this was in 2021. In terms of the vaccination in West Bank and Gaza Strip, the percentage is 0%, while in Israel it is 22.3%. And now we will go to the impact of COVID-19. As you know, poor families become more exposed to get infected due to poor safety measures. The rates of GBV increased, and the mental state of Palestinians was also affected. Access to health services in some areas was negatively affected, as many core health services has been suspended or scaled down, which in turn has a negative impact on the population health and well-being. Chronically ill patients and people with disabilities lack access to vital treatments, medications, and services they need. And now COVID-19 in numbers, the total confirmed cases in Gaza, it is 46,524. The total recovered, we have 38,739, and the active cases, it is 7,323, and the total death, it is 462. Now this chart shows the recovery rate. As you can see, it is the lowest in Gaza Strip compared, for example, with Qatar. In Gaza, it is 78%, while in Qatar, it is 98%. And now the COVID-19 prevalence rate, it is the lowest in Gaza at 2,076 per 1,000. In Qatar, it is 5,364.9 per 100,000. Now, what about the vaccine in Palestine? Let me mention the following information, which you already know well. Israel became the first country in the world to administer COVID-19 vaccines to its people, and it managed to get 14 million vaccines for the Israelis and those who hold Israelis IDs only, but gave nothing to Palestinians. So practically, they are vaccinating 8 million Israelis and not vaccinating 5.2 million Palestinians living in the occupied territories. Israel is offering vaccines to the settlers living in the illegal settlements in the West Bank. And also it ordered the guards in jails to get vaccine, but more than 5,000 Palestinian prisoners are getting nothing. And what does this mean? This confirms again that this is really a system of racial discrimination, which can be only compared to apartheid system. And this is it is a medical apartheid, which is the worst form. And now we will go to challenges to getting vaccinated in Palestine in general. We lack access to vaccines. We have a severe shortage in money, and we lack the infrastructure to distribute the vaccine. Now I will be speaking about general challenges. As I said before, the Israeli occupation and the Gaza blockade still impose a threat to the Palestinian health system and to the Palestinian health and well-being in general. And I think it is enough to refer to the international reports, which also reported that Palestinian territory is the second most dangerous place on earth for the healthcare workers. And there is also a severe destruction of infrastructure of the health sector and repeated attacks on medical personnel. So, and unfortunately, we have intra-Palestinian division, and this, the negative measures taken by Palestinian employees, such as cutting the salaries and resorting to early retirement, and the absence of training opportunities for medical staff, and this lead to migration of health experts to outside Palestine, and also the absence of laws, health regulations, and the development of development plans, in addition to insufficient budget for the health sectors. Now, the funding and external support continue to decline. There are also the new political funding conditions that clearly violate the humanitarian work. And in terms of the coordination, we have a good level of coordination between the different health players or actors in the field, but it does not reach to the level that we aspire to. And in terms of the provision of services, responding to the health needs of people in Gaza, especially for vulnerable groups, has become a very big challenge in the light of the shortage of medical equipment and medicines and laboratory tests and the personal protection equipment and the insufficient healthcare staff. A guarantee to provide vaccinations to people is still one of the major challenges. And finally, I will go to the recommendations. We as Palestinians call for real interventions from the international community to pressure Israel government to lift Gaza blockade and to end the Israeli occupation and to give Palestinians the right to build their independent state according to the international resolutions, facilitate the work of humanitarian and health workers, and to ensure the movements of patients and medical staff outside Gaza, protect the health teams, the health infrastructure from the Israeli violation, provide sufficient funding to cover conditions imposed on funding and balanced and real solutions. Take practical and urgent steps to provide the health sector with all necessary needs of medication, equipment, and laboratory tests to confront COVID-19. Immediate pressure on Israel to allow supply of vaccines to health professionals to begin with, so as to avoid the collapse of the health system, and then to the elderly. Number two, to hold the Israeli occupation for its full responsibilities as an occupying power and to obligate it to protect the health of Palestinians under occupation, including Palestinian prisoners in Israeli jails, and to ensure the provision of health services to all people without discrimination. Israel bears moral, humanitarian, and legal responsibility for vaccinating the Palestinian population under its control, and to speed up the end of Palestinian division and call on the Palestinian government to increase the proportion of spending on health sector. We as Palestinian authorities to fulfill its legal responsibilities toward the humanitarian and health conditions in Gaza Strip. And finally, the COVID-19 is a global pandemic that has affected everyone in the world, regardless of their religion, race, ethnicity. And in order to get back to our normal life, we must work together and coordinate with each other to put an end to this pandemic and to save what could be possibly saved. So thank you for your attention and keep safe.
Thanks very much, Dr. Fatiha. Our next speaker is Ben Bouquet. He's going to be speaking about barriers to accessing healthcare in Gaza. So over to you, Ben. Should say Dr. Bouquet.
Hi, good morning. Thanks Itan, and thanks Beth and Saja for your presentations as well. I hope that what I'm going to say it will complement the other speakers. I'll just make that large, and hopefully you can see it okay. I'll also put my video on so you can see me. Morning. So yeah, as Itan said, my name is Ben. I work with WHO, and this morning, I'm just going to try and see how I can flick. Yeah, we'll talk to you a bit about barriers to accessing healthcare in the Gaza Strip. We'll start off by just looking at access, how we understand that as WHO, and how we apply it, because it's put in very general terms, especially when it's referred to in international law, and then focus just on two elements of the broader concept of access around how availability and financing impact on access, and then looking at access's ability to reach and the impact of the permits regime. And then briefly, if we have time, just outline the recommendations made to the World Health Assembly. So many people, I think if you're familiar with the legal context, and I see that we have quite a lot of experienced people on the call, you'll be aware of the framework that's used for health services core components in General Comment 14 that was issued by the Committee on Economic, Social and Cultural Rights, that talks about availability, accessibility, acceptability and quality of healthcare services. So just trying to operationalize that framework a little bit, this is the Tanahashi framework, which is used by WHO in its handbook for assessing barriers to access for populations. So you can see, if you take the example, for example, let's say of diabetes care, you will have a certain population that's in need of diabetes treatment and screening, the availability of specific services to the population, and then access, which we can break down into physical access, information access, financial access, and also non-discrimination. So that's what this specific framework understands as access. And then whether those services are acceptable will mean an even smaller proportion of the population is reached acceptability in terms of, let's say, cultural or gender sensitivity. And then the contact coverage is the proportion of people that actually reach the service that they need to. And then the effective coverage after that links to this idea of quality, that you still need to have the proper training of health staff, the availability of the essential supplies, essential medicines, investigations for that intervention, for that contact to be effective. And I mean, the main point of this slide, I won't go into it in any depth, is just to point out that the concept of access is a very broad one. In this framework, which is developed in the public health literature, the top line there talks about elements of access that are determined by the provider. So the typical things that are focused on within the legal obligations around availability, affordability, acceptability, etc. But there are also all of those determinants or factors that are there for the population. So having the ability to reach, the ability to perceive, ability to seek. And these abilities are really linked to what we call, that Saja referenced in her presentation, determinants of health, or the determinants of health outside of the healthcare sector that also impact on our access to essential health services. And I won't touch on this in any depth, as Beth said, that Elvina will be discussing the specific obligations on Israel, the PA, and all duty bearers. But just when we go into that discussion, maybe just to think about, particularly when it comes to the entitlements that are outlined within international law for the right to health, you can see all these different elements of access come through and are delineated. So moving on to the Palestinian context, and also just building on what Beth and Saja have been saying already about the structural context of the Palestinian healthcare system. And we can look at how specific barriers have been created through this historical lens, how also particular providers have come to play a dominant role in the healthcare system in the Gaza Strip. So even the initial displacement of Palestinians in 1948 created this substantial role for UNRWA, where in the Gaza Strip, more than 2/3 of the population are refugees. Since its occupation in 1967, Israel has had obligations and also plays a role in provision of healthcare for the Gaza Strip, specifically for the prison population that go into Israeli prisons. The Palestinian Authority, since its creation under the Oslo Accords, has specific provisions, specific responsibilities, I should say, for provision of healthcare that still apply to the Gaza Strip, though that situation is more complicated in what it's providing versus what the de facto authority is providing, with Hamas responsibilities arising since the governmental split in 2007. And then, of course, there's a large amount of donor dependency, which creates a substantial role for third states and international organizations and NGOs. I won't go into any detail, but that's just building, just to outline and give you an indication of the proportion of healthcare that's provided by these different providers. And you can see, yeah, the role of the Ministry of Health without going into the division of the specific provision that's being taken care of by the Ministry of Health, the Palestinian Authority versus the de facto authority. UNRWA, NGOs, private healthcare, which has a minimal role in the Gaza Strip, and the Israeli prison service, which serves the Palestinian prisoners in the Gazan prisoners in Israeli prisons. So this also linking to what Saja was mentioning. So 3.8% of GDP is accounted for by governmental healthcare expenditure, but overall you have a much higher proportion of GDP that goes on total healthcare spending. But still there's a substantial role for the government for public healthcare provision, and most of the population is dependent on governmental healthcare provision for access to healthcare, particularly for more specialist treatments. And I think the main take home of this slide, in fact, is that when we think about the revenue raising of the Palestinian Ministry of Health, it's overwhelmingly dependent on central provision of funds from the Ministry of Finance. So just 12% of its revenue comes from insurance contributions. And when we then look at what the barriers to revenue raising are for the Palestinian Authority, we can think about how that has a knock-on effect for the healthcare system. So you have loss of revenue through lack of control over natural resources, loss of revenue, as Beth already mentioned, around because of a lack of control over customs revenue. And that really came to a head in both 2019 and 2020, precipitating the fiscal crisis of the Palestinian Authority. And you also have very high levels of unemployment, which impacts on the income taxation of the government authorities. And this historic dependence on access to the Israeli labor market, which has really been cut off in the Gaza Strip. And I think this statistic I always find quite striking, that today, or last year, 45% of Gaza's population was unemployed. And if you look back to the mid-1980s, then 45% of Gaza's employed population worked in Israel. This is the expenditure of the Ministry of Health overall, the Palestinian Authority Ministry of Health. As I say, it doesn't give a breakdown, but when I go into some of the specific elements of this, I'll give you a disaggregation between the West Bank and Gaza. But more than 2/5 of the Ministry of Health's expenditure is accounted for purchasing healthcare outside of the Ministry of Health, so from NGOs or private providers, and we'll go into some depth on that. The other major expenditures are salaries and then the provision of essential medicines and consumables. Again, ignore the tables, just think of it as a background picture. But there is a small inequity in the availability of healthcare providers or healthcare staff between the West Bank and Gaza. This is just a static picture. Saja already mentioned some of the pressures of migration and the differential payment, of Palestinian staff within Palestine compared to outside. That's putting a lot of that pressure to emigrate abroad. And then this also doesn't account for the fact that 60% of the public healthcare staff in the Ministry of Health in Gaza are paid by the de facto authority, who have been employed since 2007, with only 40% paid by the Palestinian Authority. Saja already went into depth on this, but yeah, just to give you an indication of the trend in the lack of availability of essential medicines. And this is important in the legal obligations because provision of essential medicines is one of the core minimum obligations on states that they have towards their population. And you can see that in the last 3 years, that's really jumped from around 30% prior to 2017 to being around 45% of medicines that have less than a month's supply during monthly stock takes, which is an approximation slightly higher than the absolute depletion of medicines. This graph just gives you a trend of the overall issuing of referrals. You can see that it was going up a lot between 2013 to 2018, and then it's declined slightly in 2019 and then quite substantially declined in 2020, although that data is incomplete. That's just for the first 3 quarters. And if you look at the proportion of referrals that are issued for the Gaza population, it varies between just under 25% to around 30%, though the population comprises 40% of the Palestinian population. If you look at inpatient referrals, then the distribution is much closer to the population distribution. So you'll see about 40% of inpatient referrals are for the Gaza Strip. And most of these referrals that are being issued by the Palestinian Authority to outside providers are for cancer care, so oncology, and there will be cancer patients who are referred, for example, for neurosurgery or hematology or other specialties. I think it's always helpful to hear people's stories, and this is Manal, who was a 6-year-old girl who received surgery at Shifa Hospital in Gaza in July 2019. She then received a permit to be treated at Najah Hospital in Nablus, and she needed a bone marrow transplant. So you can think about all the different levels of the determinants of her access here. There was the policy from the Palestinian Authority to end referrals to Israel, so she was referred to Jordan. In the context of COVID-19, access to Jordan wasn't possible. After months of waiting and being unable to access, she was returned to the Gaza Strip on the 30th of June, went into quarantine for 3 weeks and died shortly afterwards on the 7th of August. And this, of course, also in the context of the Palestinian Authority fiscal crisis. So in the last part of this talk, I'll just cover the access as ability to reach and barriers to that in terms of the permits regime. And Beth already touched on this in terms of the 2 entry points, so I won't go into depth. So this diagram, and if you just look on the left-hand side there with the map, you'll see that 70% of referrals that are issued by the Palestinian Authority need permits in order to access healthcare. And the vast majority of those, 66%, are going to the West Bank, including East Jerusalem, and just 3%, and these figures are for 2019, went to Israel. Around a fifth are referred within Gaza, and then for 2019, 13% went to Egypt. Now, the pattern substantially changed in 2020 because of the severe barriers to access, the complete closure of Rafah for much of the year, complete closure and inability to go to Jordan as well. So you had a higher proportion being referred within the Gaza Strip. But I'll come to that in a second. So the first 4 steps of this diagram are the responsibility of the Ministry of Health, let's say, or the initial medical provider. So the doctor who will see the patient makes the decision that they need the referral. It's approved financially and medically by the Ministry of Health, who set an appointment date. And then there is the permit application to Israeli authorities. And in 2020, this is what ended this permit application that was previously being administered by the Health Liaison Office, which is an office of the Ministry of Health. With the end of the coordination, that closed, and then different organizations, including WHO, took on some responsibilities for applying on behalf of patients. I'll skip this, but it's just a very quick point to say that the proportion of permits or the percentage of destination of permits for different you can see on the left-hand side here, sorry, the destination of permit applications from Gaza, I'll say it properly, is higher. There's a higher proportion going to Israel there because there are also privately financed or NGO referrals that are included within that figure. So there's been a massive decline in access in the approval rate of patients from 2012 to 2017. So more than 90% in 2012 being approved to around 54%. And then that's stabilizing from 2017 to 20. Of course, that really masks what has been the substantial trend over the last year. So looking from 2008 to 2009, you can see there's been an almost trebling or more than trebling of the number of permits being issued. And then when we moved to 2020, a really drastic decline in the permit applications and the crossings across Beit Hanun or Erez terminal. So around less than 10% of the previous access for patients. So this was really substantial. And even those patients that continue to apply or were able to make applications faced considerable barriers. And I think Mohammed's case really underlines what we mean when we use the term arbitrary and apply it to the system of permits. So he applied 4 times before he was approved on his 5th time. 3 of those times he was denied and once delayed. And he really needed timely healthcare. So he had a brain tumor, needed adjuvant radiotherapy and chemotherapy, which is a time-sensitive treatment. So as medical doctors, we know that giving this in a timely way increases the effectiveness of the treatment. So this system is impacting on the timeliness of treatment that patients get. As we said, just as with the referrals, the majority of permit applications, or the single largest reason for permit applications, are for cancer patients. And very quickly, because I realize I'm going a little over time, but we just, these next few slides are just to really underline the vulnerability of these patients. So we did a study looking from 2008 to 2017, matched the referrals and permits data with mortality data. And we found that overall, all patients that made permit applications from the date of their first permit application, at 6 months, 8% had died. And if you look at urgent referrals, then at 6 months, just under a fifth of patients had died. And life-saving referrals at 6 months, just over a quarter of patients had died. So this really underlines that these patients are extremely vulnerable. I'll skip this, but the other thing that we did in that study was that we compared those who were initially delayed and denied with those who were approved initially. And we found that initial delay and denial led to reduced your chances of survival by around 1.5. Another point just to make, and I'll finish there, is that there's a heavy securitization of healthcare access. So more than 2,000 patients, or there were more than 2,000 patient interrogations and more than 800 patient companion interrogations between 2014 and 2020. And this photograph in the slide is a picture of a very famous case of Ahmed Shbir, who died in early 2017 after he was interrogated on 2 occasions and refused to provide information and then denied. And the testimony of his father is very emotional and striking if you have the chance to read it, if you haven't come across it. So I'll skip these slides, but we can send on and refer you to the World Health Assembly report for the recommendations. But thanks very much.
Thanks very much, Ben. By the way, we will make the slides available to everyone, so they'll be able to see. So thanks again, Ben, and also to Saja and Beth for connecting us a bit to the factual situation and to the human toll that this issue is taking. I'm now going to pass on to Elvina, who's going to reflect on the law that applies to this factual situation, and hopefully also outline how the law ought to at least contribute to alleviating some of the human suffering that is being caused. So over to Elvina. The title of her talk is "How Does International Law Protect Gazans During the COVID-19 Crisis?" Over to you, Elvina.
Thank you, Ethan. Can you hear me properly, everyone?
Yes.
Yes, perfect. Thank you so much. So thank you to our three panelists for their all their insights and to Ben for providing those human stories. I think that illustrates from a human point of view all the challenges that we are talking about today. So within the next 15 minutes, I'll focus only on the applicable law. So I think it's going to be a drier presentation than those of the previous panelists. So I'll address how international law deals with the multiple challenges that the three panelists have been highlighting for us. I won't be able to apply specific rules to each and every of these challenges, but I'll try and highlight the main relevant rules and provide a few examples. And I also have some slides, but for them I'll rely on Yusra because I had a small technical issue this morning. So Yusra, I think you have my slides. So whenever you are ready, you can share them. Thank you so much. Okay. So I think a first important point that is essential to bear in mind if we are to look at international law as it applies to Gaza during the COVID crisis is that it's important to look not only at the rules that apply specifically during and to the COVID-19 crisis, but to look rather at all rules that protect Gazans more generally. Because what the three panelists, I think, made clear is that the occupation and the blockade of Gaza accentuates Gazans' vulnerability to the COVID-19 crisis, and it impedes the ability of the local authorities to overcome the crisis. So we really have to address rules specifically relevant to the crisis, but also pre-existing and ongoing violations of international law that affect disability. So as Ethan mentioned at the start of the event, there are different authorities that have an influence on the COVID-19 response in Gaza. There's Israel, the Palestinian Authority, Hamas, and third states. So the purpose of the legal brief that we published 2 or 3 weeks ago now was to really clarify the respective obligations of these different authorities. So for instance, who is responsible for supplying COVID testing kits or vaccines? Who is responsible for ensuring continued access to healthcare for COVID as well as to non-COVID patients? Who is responsible for implementing lockdown measures in Gaza, etc. So this is what the brief tries to achieve. Again, I won't do it justice in 15 minutes, but I would encourage you to consult it. It's available on our website. So you'll find, of course, more details on the legal brief, in the legal brief itself. So first of all, and Yusra, you can move now to slide 2, please. Thank you so much. So just to give again a broad overview, Ethan already gave this overview at the start, but as a reminder, so the two main bodies of international law that are applicable to Gaza and relevant to the situation are IHL and human rights law. I won't delve into the reasons why at Diakonia we consider that Gaza is still occupied and that Israel still retains the status of an occupying power, just in the interest of time, but I'm happy to provide details if you wish during the Q&A session. What I will highlight again, but Ethan already mentioned it, is the question of what is the scope of Israel's obligation under the law of occupation. Is Israel bound by the full body of occupation rules or only by some of them? And so at Diakonia, like others, such as the ICRC, but also Gisha, as we just heard from Beth, we follow a functional approach to the law of occupation. So this, in concrete terms, means that the scope of Israel's obligations is a function of the control it exercises. So Israel is bound by the law of occupation in relation to those issues or to those areas of life over which it has control, and only in relation to such issues. So to give only one example, Israel has control over the availability of healthcare in Gaza, as we'll discuss in a moment, so it is bound by obligations relating to healthcare. On the contrary, it does not have control, for instance, over the legislative power in Gaza, so it is not bound by the rules of the law of occupation relative to legislation in the occupied territory. This is what the functional approach to the law of occupation means. Human rights law is also applicable in Gaza at all times. So as Eitan flagged at the beginning, Israel, the PA, as well as Hamas are bound by human rights law in Gaza, each for different reasons. Again, for the interest of time, I won't come back to that. I will simply flag that you could say that the logic in terms of which kind of human rights law obligations are binding on each of these actors, the logic is roughly the same as for the functional approach to the law of occupation. And by that, I mean that the scope of each of these actors' obligation depends on the control they exercise over certain areas of life or over certain human rights of Gazans. So I think, as is clear from our legal brief, it's really essential to understand this logic, the fact that the scope of one's obligations depend on the control it exercises over persons or over areas of their life. And that's essential in order to understand which obligations fall on Israel and which obligations fall on the PA or Hamas. So moving on to slide 3. Thank you, Yusra. So I'll focus on obligations related to health. So how does international law protect the health of Gazans during the pandemic? There are a couple of provisions that cover the challenges that Ben and Saya in particular highlighted earlier. I just decided to provide an overview of those rules because it's not always clear, I think, which rule covers which aspects of the protection of health. So I think it's always useful to have the legal language to be precise. So under IHL, there are 4 main provisions that are relevant to the protection of health. The first provision, and it's important because it's a general provision, it is Article 43 of the Hague Regulations of 1907, according to which the occupying power is responsible for ensuring public order and civil life. Civil life is the translation of the term la vie publique, the French term la vie publique. And so that's a notion that is quite broad. And as noted by the Supreme Court of Israel, the notion of civil life covers different aspects of life, including the economy, education, welfare, or health. The other relevant provisions of IHL, you find them in the 4th Geneva Convention of 1949, which is the convention that protects civilians living in occupied territories. So there in the 4th Geneva Convention, you have Article 55, according to which the occupying power is responsible for providing food and medical supplies. So here, the important element is that it's not just about letting those supplies in the occupied territory, but it's really about the responsibility in providing those supplies. Then you have Article 56, specifically relevant to health, which states that the occupying power must ensure, with the cooperation of national and local authorities, public health in the occupied territory. That is to the fullest extent of the means available to it. And interestingly, of course, in the context of the COVID-19 pandemic, Article 56 refers specifically to the measures that the occupying power must take in case of epidemics. And finally, another relevant provision is Article 59 of the 4th Geneva Convention, which states that the occupying power must allow and facilitate the passage of relief supplies. So this provision is about the supplies provided by third parties, so by third states or international organizations, rather than the supplies provided by the occupying power itself, according to its obligation under 55, right? So 55 is about the duty to provide the supplies by the occupying power, and 59 is about the passage of supplies provided by others. Thank you, Yusra, for 4 slides. So under human rights law, the health of Gazans is protected by the International Covenant on Economic, Social, and Cultural Rights, which is ratified by both Israel and Palestine. And specifically, Article 12 of this covenant protects the right to health, enshrines the right to health. So it states that states that ratify this covenant recognize the right to everyone to the enjoyment of the highest attainable standard of physical and mental health, and with a specific mention to the prevention, treatment, and control of epidemics. As Ben mentioned earlier, the UN Committee on Economic, Social, and Cultural Rights, which is the UN body that is in charge of monitoring the implementation of the covenant. So this UN body clarified the exact content of the right to health. It clarified it in general comments, general comment number 14. So it's an important source because it provides details about really the content, the meaning of the right to health. And as Ben mentioned, this right to health includes elements of availability, accessibility, acceptability, and good quality. So respecting those standards is necessary not only to comply with one's human rights law obligation, but these standards are also very useful to give meaning to the IHL obligations. So I was referring earlier to, for instance, Article 56 of the Fourth Geneva Convention. You can go back to the previous slide, user, sorry. So Article 56 of the Fourth Geneva Convention talks about public health. And so in order to understand what public health means, what good quality healthcare means, one should refer to the details provided by the UN Committee on Economic, Social, and Cultural Rights. So now let's apply this legal framework to the Gaza context, and we can move to the next slide, Yusra, please. Thank you so much. Okay, so what are each of the relevant actors' obligations under IHL or human rights law? So Israel's obligation. So because Israel controls Gaza's land borders, as Beth detailed for us, it exercises de facto control at least over the availability of healthcare in Gaza, its quality and acceptability, as well as over Gazans' access to healthcare outside Gaza. And naturally, with this control comes a number of obligations. So I won't mention them all, but we can mention in particular Article 55, the duty to provide medical supplies to the occupied territory. So during the COVID-19 pandemic, a number of supplies are relevant. For instance, any sort of personal protective equipment to protect from the virus, testing kits, ventilators. Saya mentioned earlier that those items were lacking in Gaza. So that would be Israel's duty to provide those medical supplies. And interestingly, this would also concern vaccines, which are type of preventive medicine, so medical supplies. Israel must also allow and facilitate the passage of medical and other supplies provided by third parties. So that's under Article 59. So this would concern not only the medical supplies that I just mentioned, but also all supplies that would be necessary, for instance, for the maintenance of the water and sanitation systems. So, you know, any materials necessary for the maintenance of the systems or consumables like fuel, for instance. This would be an obligation by Israel to allow and facilitate the passage of these supplies, especially during the pandemic, given that water and sanitation systems are essential to fight the virus. I will simply note also that the duty to facilitate the passage of supplies, if you apply this to vaccines, for instance, this would include the duty to respect the cold chain, for instance, so by refraining from undue delays at the border, for instance. Israel must also take all appropriate measures to the fullest extent of the means available to it to ensure public health. That's under Article 56 that I mentioned earlier. So this would cover a lot of different measures, but perhaps to link to what Beth and Ben were mentioning earlier, so to link it to the movement of persons in Gaza, ensuring public health would include allowing Gazan medical personnel to travel outside of Gaza in order to receive proper training, but also to allow and facilitate patients who are referred to facilities outside of Gaza to receive care there. And that, of course, is particularly relevant during the pandemic because, as we know, the health system is under huge pressure. Now, moving on to the obligations of the Palestinian authorities. So at the Palestinian level, as Ben explained to us, control over healthcare services in Gaza is shared between the PA and Hamas, in the sense that the PA is, as a matter of fact, in charge of securing the provision of essential medicines, paying health staff, and medical referrals, whereas Hamas runs the local health system more on a daily basis. So correspondingly, one can identify specific duties for each of these, for both actors. So for instance, the PA, so this is of course by no means exhaustive, but just some illustration. The PA would be responsible for ensuring the availability of medicines in the strip, of course, to the maximum of its abilities, and taking into consideration the obstacles that the occupation and the blockade of Gaza creates. It would also be responsible to create the conditions to ensure that everyone within the Palestinian territory has equal access to care. And the Palestinian territory includes the West Bank and Gaza, of course. So that would be a responsibility for the PA. On the other hand, Hamas, as the de facto local authority in Gaza, also has a number of obligations deriving from the human rights to health. These obligations, or rather the positive obligations of Hamas, are commensurate to the resources at its disposal, but also commensurate to the control it has on the public health situation in Gaza. So concretely, Hamas could take a number of measures. I'll mention only a few: ensuring timely access to COVID testing and the establishment of quarantine facilities, running education programs concerning rules of hygiene that help contain the spread of the virus. So this is really much a responsibility for Hamas. Taking specific steps to prevent the spread of the virus in places of detention. I think Saiha mentioned this earlier, places of detention that Hamas is running, of course, or when stay-at-home orders or curfews are imposed by Hamas, so Hamas must ensure that these restrictions of movement are compliant with human rights law. And that means in particular, making sure that those restrictions are necessary and proportionate to contain the virus. As highlighted in our legal brief, and also highlighted by Saha earlier, of course, the COVID-19 crisis has severe effects not only on health, but also on livelihoods. That's particularly the case in Gaza. So how does international law protect the livelihoods of Gazans during COVID-19 crisis? So here again, we go back to this general provision of IHL, which is Article 43 of the Hague Regulations. And as I was mentioning earlier, it's a duty of the occupying power to ensure public order and civil life includes economic life. This obligation is coupled with the right to an adequate standard of living, which is enshrined in Article 11 of the International Covenant on Economic, Social, and Cultural Rights. So these are the two main rules relevant to the protection of livelihoods. So what are Israel's obligations? So like for health, Israel exercises a significant degree of control over the livelihoods of Gazans through the blockade and the associated regime of access and movement restrictions highlighted by Beth. And accordingly, in order to comply with its international obligations, as we highlight in the legal brief, Israel must lift arbitrary restrictions on the movements of goods and persons that prevent Gazans from enjoying an adequate standard of living. Obviously, this is particularly vital in the context of the COVID-19 crisis, which is severely hampering Gazans' ability to meet their even basic needs. On the other hand, the Palestinian Authority and Hamas also continue to bear obligations under human rights law during the pandemic, including as it relates to livelihoods. So as I said earlier, when they impose stay-at-home orders, those restrictions must be proportionate to what is necessary to fight the virus. The PA and Hamas should also take steps to mitigate those restrictions of movements and their impacts on the local economic life, again, to the maximum of their ability, while paying particular attention to the situation of individuals and groups in vulnerable positions, such as persons with disabilities. And finally, very briefly, because I'm running out of time, for the final slide, I will deal with the question of education, which is also another aspect of life that is obviously severely impacted by the COVID-19 crisis, or rather by the measures adopted to fight the virus. And there I will flag 3 relevant legal provisions. Again, Article 43 of the Hague Regulations, the duty of the occupying power to ensure civil life, which includes education. Article 50 of the Fourth Geneva Convention specifically addresses education and the relevant duty of the occupying power. So the occupying power must facilitate the proper working of all institutions, of all education institutions. And Article 13 of the International Covenant on Economic, Social, and Cultural Rights, which reflects the right to education. So to give just one example, because Israel controls the supply of electricity to Gazans and therefore their access to internet, and also considering that during the COVID-19 crisis, students in Gaza are forced to attend schools through distance learning, there is an argument to be made that during the crisis, access to electricity and internet are essential utilities in order to ensure continued access to education. And so it can be argued that power cuts are incompatible with the right to education during the COVID-19 crisis and incompatible with Israel's duty as an occupying power to ensure the proper functioning of educational institutions. As far as the PA and Hamas are concerned, again, there are a number of measures that they can take in order to comply with their obligations under Article 13 of the Covenant. For instance, adopting and implementing a contingency plan for educational authorities to mitigate the effects of the crisis and make sure that special educational needs of students are taken into account. I don't think I have time to address the obligations of third states, so maybe I can address this during the Q&A if there are any questions on this, and otherwise I'll refer everyone to the legal brief. There is a part on the obligation of third states, and I'm happy to answer any questions or provide clarifications. Thank you.
Thanks a lot, Elvina. So yeah, we do have a little bit of time for questions. So as we said, if anyone wants to raise a question, please raise your hand virtually and we'll address it. We did have a question coming through before from the chat for Saja. So I'll perhaps present that question and then so we'll give time for people who may want to raise another question. So the question for Saja was, to what extent do the testing capabilities of the Gaza Ministry of Health limit the accuracy of the numbers published of positive cases in Gaza? So I assume because the testing capabilities are limited, there's a limited capacity to reflect the actual numbers. So perhaps if one of you wants to take that.
As you know, the Ministry of Health in Gaza do not have enough capacity to test all the risk people groups, all to conduct also a random samples. So this of course will affect the prevalence. As you saw from the chart I presented, the prevalence in Gaza is so low, and this is because not all the people do have access to PCR testing in the Ministry of Health, and the ministry is also is only testing like specific cases and very high risk group people. And if a normal people like a youth who is suspected to COVID-19 and and want to go to the ministry for a test, okay, he will not have access to this, to the PCR testing due to the scarce resources of the laboratory material. So of course, this will affect on the positive cases percentage. And that's why we to scale up the testing capacity of the Ministry of Health in Gaza to include more people in the testing procedure.
Thanks a lot. Ben, did you want to add something? I got the impression you might want to add something. Perhaps I'm wrong.
Sure. No, maybe just add to that. I mean, it might be helpful to just see this this issue of the positivity of the tests, and you can see how that's changed with time. I'll just quickly share this graph here, so you can see that the positivity rate from the 14th of November has really jumped with the kind of much higher shortages. And if you think back to the diagram that I did at the beginning of my presentation as well, I mean, here we're just talking about the barriers to availability, but then there's also all the issues around access, which might relate to financing, to physical access. There's the acceptability, even just the belief in whether COVID is a thing, you know, so there's all of these barriers. Even when we talk about the positivity or the number of cases in any setting, it's going to be a reflection of a proportion of the real cases, because it's the number that actually reached the service, did the test, tested positive, even accounting for false negatives. So, but this gives you an indication of even those that we're managing to reach because of the under-testing. There's a much larger positivity rate. So that means the proportion of tests that were taken that tested positive. And when you're reaching sort of 2/5 of tests being positive, that shows that there's really under-testing of the population. It's over. Stop sharing.
Thanks a lot, Ben. I see there's another question that came through in the chat. So I'll read it out. So first of all, we're thankful for the enlightening information. And then the question is, what are the practical steps to take such information forward? What is our capacity as a network to make best use of international humanitarian law and international human rights law to impact the current situation? Yeah, so those are pretty big questions. I don't know if anyone wants to take them. In a way, the question about IHL and international human rights law, that might be an opportunity for Elvina to perhaps add on third state responsibility, because I think that's quite important in generating pressure on the actors involved to address the issue. So perhaps Elvina, you can say, from that angle, you can tackle this.
Yes, yes, thank you for the question. That's indeed an important point, and it's an opportunity to recall that not only parties involved well, let's say, yeah, not only the local authorities and Israeli authorities have obligations under international law towards Gazans, but also all states that are parties to the IHL treaties and to, for instance, the International Covenant on Economic, Social and Cultural Rights. So in relation to the International Covenant, because I mentioned it more than other human rights law sources, I will simply recall that the Covenant recognizes the role of all state parties as members of the international community, their role in achieving the realization of the rights enshrined in the covenant for all human beings. So basically, states, when they ratified the covenant, they agreed that they have a responsibility in achieving this objective, specifically or notably through international assistance and cooperation. So this language, international assistance and cooperation, is mentioned in the covenant. I think it's Article 2, but I may be mistaken. I'll double check. So that's the main point. Also, perhaps worth mentioning is in the General Comment 14 of the UN Committee on Economic, Social and Cultural Rights that I was referring to earlier. So this general comment that clarified the content of the right to health. The UN committee noted that the international community has a collective responsibility to address pandemics, a collective responsibility, that's the language used by the UN committee. So that's again important. And it also specifically noted that economically developed states bear a special responsibility in this regard. So this could include notably the provisions of goods and services necessary to fight the COVID-19 crisis in Gaza. I'm thinking of vaccines, of course, including vaccines, but also the sharing of expertise with local medical personnel on appropriate preventive measures. So again, a responsibility of third states in that regard. Also important to mention is a responsibility of third states vis-a-vis the violations committed by Israel. Sorry, there's only one state of Israel. So perhaps just a couple of points, I don't want to be too long, but there is an obligation for third states in the first place to not render aid or assistance to Israel in the commission of its violations, including in maintaining the blockade. So there is a duty of third states not to render aid or assistance to Israel in the commissions of its violations. And there is also a duty by third states who have an influence over Israel, who can exert any form of influence over Israel. Those states have a duty to use their influence in order to prevent Israel from violating its human rights law obligation and its IHL obligations. So under the Geneva Convention, you have an article, Article 1, which is an article common to each of the conventions, which specifically states that states parties to the Geneva Conventions, which is basically all states on the planet, because the Geneva Conventions have been universally ratified, all states have a duty to ensure respect for IHL. So not only themselves, they have to respect IHL, but they have to ensure respect for IHL by others. And that includes, again, the duty to use their influence, if any. Of course, perhaps not all states have the ability to influence Israel, but those states who do, they have to use this influence to bring Israel back to compliance with its obligations. So to link to the question asked by one of the attendees, I think, yeah, it's important to bear this in mind, that third states have obligations, because there is, of course, a lot of work to do in that regard to raise awareness with them towards their own obligations and what steps they can take to also comply with international law and achieve better protection for Gazans.
Great, thanks a lot, Elvina. I'll complement. I see we have another question for Ben, and then we should probably close. But just to complement what Elvina has just said, what we've been trying to do at the Diakonia IHL Center is to highlight what the law requires from the various actors. And Elvina has just added now to clarify that it also makes certain requirements on third states. If third states would actually implement those requirements, the situation would probably be a lot better. But with international law, in addition to stating what the law requires, it's also important to make an effort to actually induce the various actors to comply with their obligations, which is not a simple matter. And I realize not everyone in this call, not everyone here is lawyers, but there's a role for civil society, certainly for international organizations and for other states to exert pressure on these various actors to actually do what the law requires of them. So we're trying to help by articulating what those requirements are, but a lot of work is required to get the players to actually do what they're obliged to do. And lastly, and I think we'll close with this, there's a question here that's directed for WHO. So Ben, perhaps you can take it up. It's the role of WHO with regards to barriers to Palestinians in Gaza accessing healthcare during COVID-19 and vaccinations. I don't know if the question's clear.
Thanks, Safa, for that question. Yeah, maybe it's worth just linking back here to the role of WHO as it's been outlined in International Health Regulations 2005. So even the origins of the establishment of the organization relate to earlier versions, even preceding the organization of the International Sanitary Regulations. So the more updated version of that in 2005 was trying to place WHO's position internationally in being able to equip states to respond to diseases that are emerging diseases and not well described already. So the description of sort of risk to public health is this term of public health event. So WHO in January, I mean, because I think in relation to Gaza, it's also important to outline WHO's international role here. So in January, soon after the reports from China, WHO declared this a public health emergency of international concern. On the basis of that, then it has to convene a committee of experts who provide guidance and inform and advice to states on how they should be responding. And then WHO's actions on the ground are guided by the emergency response framework, which outlines the specific roles of WHO, which are particularly around coordination, risk communication, technical advice and guidance. And then there is a role of provider of last resort in the event that there is no provision. When it comes to the vaccination, WHO has tried to highlight the international inequities in provision of vaccination and has been involved in setting up this COVAX facility, which is aimed at addressing those inequities. And that facility, so the Palestinian Authority on behalf of the population in Gaza as well as West Bank has applied to that program for provision of vaccine. So that would be the Pfizer vaccine, and has been accepted. So that would be an in-kind donation to cover 20% of the population, and then funded. So the Palestinian Authority would pay for 40%, a further 40%, which would be provided through that. So the kind of role of WHO here is much larger than in relation to the specific the specificities around the obligations of the occupying power in relation to the population in Gaza. So this issue of the inequity, I mean, we're currently seeking guidance from our colleagues within other UN agencies who are much more, let's say, the experts when it comes to the legal obligations here, which I suspect will align with what we've heard from Diakonia today. But that's, yeah, to give you just an overview, sorry if it's been a waffling overview of what WHO does and what WHO's role is, but I hope that's helpful. And I can send documents if that would be helpful as well.
Thanks very much, Ben. So thanks, Ben, again, and thanks to Beth and Saja and Vina and for all of you for joining us today. I thought this was a really helpful session and quite important. Perhaps just in closing, unfortunately, it looks like we're going to be stuck with COVID-19 for quite a long time ahead, and it's going to continue to be an issue for Gaza and for the context more broadly. So I imagine all the organizations involved in the session will continue to work on this, and there'll be more to discuss from our side. In Diakonia, we'll continue to monitor the legal issues, the Diakonia IHL Center, the legal issues and complications that COVID-19 gives rise to in Palestine in general. One of the issues that we're monitoring most closely at the moment, and we hope to publish on and perhaps reconvene in some forum to discuss, came up a little bit in this conversation, and it has to do with the vaccines and the obligations to provide vaccines, how that plays out. It's quite complicated at a pragmatic level, but also legally there's some issues there to discuss, and we hope to convene at some later date to discuss this. So thanks again to everyone. Wish you a good day. Take care.
Thank you very much.
Thanks.
Thanks. Bye.
Thank you.